Hi, my name is Bora Keum from Korea University Medical Center. It is an honor to discuss our recent work entitled A Novel Robotic Arm-Assisted ESD Platform with Augmented Traction for Gastric Neoplasm. This was a first-in-human prospective pilot study conducted at Korea University Medical Center in 2024 involving 15 patients. Our goal was to evaluate the feasibility and effectiveness of robotic traction during gastric ESD. In gastric ESD, as you know, submucosal dissection is one of the important process to get en bloc and complete resection. One of the most challenging skills to acquire is the ability to expose the submucosal layer and maintain an adequate dissection plane during ESD procedure. Sometimes gravity may help exposing the submucosal layer during dissection depending on the location of the gastric neoplastic lesion, but it is not that easy understanding the direction of gravity and using it. If we can get a clear visualization of submucosal layer during ESD procedure by lifting up the mucosal flap, we could improve the clinical outcome and reduce complications such as bleeding or perforations. Although many various types of traction methods have been introduced, most of them still face challenges such as friction and limited control of traction direction. The device we used in this study, called Robo-Para, is a compact robotic traction system that attaches to a standard endoscope and provides precise and multidirectional traction without channel friction or traction loss. The Robo-Para platform consists of a driver unit, dual hand controllers, and alligator-type grasper with articulated joints that can rotate around the scope. During ESD, once the mucosal incision is made, an assisting endoscopist who is not directly performing the dissection controls the robotic grasper to adjust traction direction and tension. This allows the primary endoscopist to focus entirely on dissection while maintaining stable visualization. We achieve 100% en bloc and R0 resection rates. The mean total procedure time was about 28.8 minutes, with a median robotic assisted dissection time of 14.3 minutes and an average dissection speed of 48.2 square meters per minute. The robotic system was engaged for roughly 54% of the total time, and no perforations occurred and only minor bleeding events were observed. We did experience a slight decrease in angular rotation in one case, but it was easily managed within the platform. Yes, ESD procedures on upper and middle gastric lesions are generally more challenging than those in the lower part of the stomach. In this study, the reliance on robotic system was higher on middle or upper lesions, as we observed longer robotic assisted dissection time and more frequent grasping. Although further research with large data and comparison to conventional ESD is needed, our findings suggest that robotic traction can effectively help the procedure on upper and middle gastric lesions. For example, we had a case involving a middle gastric lesion with minor submucosal invasion and severe fibrosis. A clear view of the dissection line was crucial as the submucosal plane was very close to the muscle layer. The robotic traction allowed precise tension and stable visualization, enabling safe and complete dissection. We applied the NASA Task Load Index questionnaire. Workload scores correlated positively with robotic assisted dissection time, number of grasps, and total procedure time, but negatively correlated with dissection speed. Also, there were no significant differences between the three endoscopists, and they received only a few minutes of training before using the device. This suggests that the system is intuitive and predictable, and the inputs from gastroenterologists worldwide from the development stage was well implemented to ensure both safety and usability. This was a single center, single arm pilot study that mainly involved lower gastric lesions. Our next step is to conduct comparative trials against conventional ESD and other traction techniques, including more cases on upper and middle gastric lesions. We also plan to analyze operator learning curves and continue refining the traction control parameters to further improve performance. The robotic arm-assisted traction approach has the potential to lower the technical barrier for ESD and make difficult cases more manageable by improving completeness and safety. It can expand the application of ESD to more challenging lesions. With the Bora device recently cleared by FDA in October, we expect a significant advancement in robotic-assisted ESD and the broader field of therapeutic endoscopy. Thank you.